Hello and welcome to Naledi Online. We today are really excited. The guest that we have today is going to be helping us with some health issues. So it's really about your health. We know that there's so much um, pain that's going on nowadays. And we just want to hear what some of the options are that you can explore in search of better health. And so today we are excited to welcome Dr. Zhu Wei. We'd just like you to give us your name, yourself, the way you say it.
In Chinese, we
Yes,
say Zhu Wei.
Zhu Wei.
Yes, Zhu Wei. But Zhu Wei
Uh-huh.
or Zhu Wei, okay. But in Chinese, Zhu Wei.
Okay. Fantastic. Thank you so much for coming. So we want to know what you do, Doc. I did say that you're going to just help us with some health information today. What is it that you actually do?
I'm the captain of Chinese medical team in Zimbabwe. I have been here for one more year. We had a clinic in Zimbabwe. That is Zimbabwe China Traditional Chinese Medicine and Acupuncture Center, located in Paris Yadva Hospital. I provide free traditional Chinese medicine and acupuncture for people who in need. Mostly I provide acupuncture treatment for people. Sometimes I provide Chinese herbs for people who are in need.
Okay. What inspired you to be? You say you are part of a team
Yes.
that is in Zimbabwe.
Yeah.
That's really fantastic. What inspired you to be part of this team? What inspired you to offer this? You say Chinese traditional medicine?
Chinese traditional medicine.
Yes,
Yeah.
Chinese traditional medicine. What inspired you to introduce this in Zimbabwe? What had you seen?
Okay. In fact, China sent Chinese doctor medical team
Yes.
to Africa,
All
different
right.
areas of
Yes.
Africa for this year is the 60 year, successive 60 years. But for Zimbabwe, it is 50 years till now. So this is tradition that China send medical team to
Yes.
Africa. Yes. So
All right.
when I'm a doctor, as a doctor, the work is to help people recover. In China, I have been work in medical field for more than 20 years.
More than 20 years.
Yes. I'm 40s. I'm in 40s now.
Dog.
Yes.
You look a lot younger. I'm
Okay.
telling you, I wouldn't have imagined over 20 years of experience, and we get to benefit from that. We are really grateful for that. So what are some of the challenges that acupuncture can help with? If a person has what sort of pain, that they can maybe explore and seek help from acupuncture.
Okay. Because acupuncture belongs to traditional Chinese medicine. It's one part of traditional Chinese medicine.
Okay, it's one part of.
Yeah.
There are
Yes.
many others.
Yeah.
All right.
For traditional Chinese medicine, we have Chinese herbs, then acupuncture, and etc.
Okay, so what is acupuncture, maybe to begin with?
So acupuncture use tiny stainless steel needles to insert to certain acupoints on the body to regulate the whole body, like balance yin and yang, balance the body, and it can help to activate the response of the body to regulate by the body itself. So there is no medicines, no side effects, etc. It can help the body recover. Like if one had back pain, we can acupuncture certain acupoints on the body, then it can help the body relieve some anti factors to cure, to relieve the pain.
So, Doc, tell me something. When a patient comes to your consultation rooms, what is the process? What do you do first before you actually go into the actual treatment?
In fact, at first, I will do consultation. I will inquire the symptoms, the ailments, the feelings the patients are feeling. So then, according to the complaints, then I will do some physical exam to find more information of the symptoms.
Okay.
Sometimes people need to do some exam like the X-ray or CT, MRI.
Right.
Sometimes they need some blood test. So after this, I can come to a diagnose. Then I know, I decide what can I help him. Maybe with acupuncture, maybe with medicines, maybe with Chinese herbs. But in most cases, I can use acupuncture to help them.
Okay. You were also saying earlier that with your experience of 20 years, sometimes when a patient is speaking,
Yes.
you can actually tell maybe where the actual problem is.
Yes, because I have more than 20 years experience in medical field. So while I'm having a consultation with them, I can find out the problem. I can get the diagnosis, because people here they can't afford to do CT scan, MR scan, etc. So usually, in fact, in TCM we can diagnose by inquiry, observation, palpation, auscultation, etc. to do diagnose. So after a consultation with patients, I can make the diagnosis. Then I know how to help them with acupuncture.
That's great. A lot of big words for me there. We will need to capture them just so that someone watching who really needs your help can truly understand and see how they can also access this kind of treatment. Thank you so much for that. So the treatment itself, is it a once-off? Is it a process? Are there several sessions? I think I've seen some people that will be making it's by appointment. Just take us through that, how the treatment goes.
In fact, because for a disease, there is different degree. For some cases, it is very mild. For some cases, it's severe or chronic. For some, in some cases, like acute back pain or acute shoulder pain, maybe one acupuncture session is okay. Just after one session of acupuncture, they feel afraid of pain. But in most cases, like chronic conditions, they need more sessions. So they have to 2 to 3 times a week of acupuncture treatment. So they can book 2 times in a week, then 2 times in next week, etc. They can have in fact about 10 sessions for a treating course. Yeah. For some cases, maybe one course of treatment is okay. For some chronic, maybe because some people have a long history of ailments, like 10 years or 5 years, maybe then 2 to 3 or 4 sessions of treatment is good for them.
All right, I get it. Yeah. So I'd like to know some of the health challenges that acupuncture can help with. What sort of maybe patient challenges have you attended to and have you assisted through acupuncture?
Okay, this is a good question. In fact, acupuncture can be used in many conditions.
Because I thought it was just maybe pain, like your back pain, leg, arm,
Yes.
shoulder. So there's more.
Yeah, of course. For the pain syndromes, it's just one part of the applications of acupuncture.
Right.
Acupuncture has a wide range of application. It can be used in maybe any disease of the body, but the effect is different. People come to me, they have BP, have diabetes, headache, eye problems, ear problems, etc.
wow.
They, after acupuncture, they
Wow.
all improved. Some people have BP, they don't have regular taken the medicines. After several sessions of acupuncture, the BP is now normal. Yeah. So
Wow.
it can be used in the nervous systems, vascular systems, and endocrine systems, etc. It can help. In fact, many people have ED, etc., or fertility, etc. They can to have acupuncture. It also can help. So,
Wow. This is really very interesting. So at the moment, we just have one center? Or do you have many centers? Are you planning to expand to have in other areas? I know of Harare at the moment. Are you planning to expand?
yes, at present, we only have one center in Zimbabwe.
Okay.
So, in fact, it's not enough. So, I and my team, and sometimes with my students, go around Zimbabwe,
Okay.
like Bulawayo,
Yes.
and Bikita, and Mazowe, and etc. We go there for free mobile clinic. We also have plans to open more clinics in Zimbabwe. The Ministry of Health and Child Care also cooperate with us to plan to have more clinics.
That is
in
wonderful.
Zimbabwe. Yeah.
That is wonderful because I can imagine how many other people would be assisted by this service. So I know you also were training even some doctors here in Zimbabwe in acupuncture. Tell us about that.
Yes, because at present at the center only me do acupuncture for people. So in fact,
And the
at
demand
present,
is huge.
about more than 30 people a day I can serve.
Hey.
So last year I trained 10 students. So after training, they can do acupuncture now. So I also have a plan to train more people this year.
Okay, all right. You were explaining something about who can do acupuncture and the difference between diagnosis and the actual application of the acupuncture.
Yes. In fact, for me, I have more than 10 years of medical education. So in China, to be a doctor, it have to finish 5 years medical education. But there are also technicians. That is like my students here. They have about 3 months training of acupuncture techniques. Then after 3 months of training, they can do acupuncture. But to be a doctor, they have to learn more. Yeah. So
okay.
also some people ask me to come to learn acupuncture. If they are doctors, if they are nurse, and if they have medical education background, it's better.
Right.
But if they don't have,
Starting
it's
out.
also okay. They can be technicians. They can do acupuncture. But for doctor, they can do diagnosis and know how acupuncture can help them. It's better.
Okay, all right. So if I'm getting you correctly, one can train to do acupuncture, but in order to then be able to diagnose and all of that, they would have to have medical background. They would have to have been trained as a doctor to do everything. But So you mean anyone can maybe learn to do acupuncture itself?
Yes. For technicians,
Yes.
that they can do acupuncture, then they can under the guide of a doctor.
Supervision of a doctor.
Yeah, supervision of doctor. They can do
I get
acupuncture.
that. I get that. Ah, that's fantastic. So I hope someone listening out there who's looking for a career as well might actually be interested in this. I am quite sure of it. But what is your advice to those with certain ailments? Do they just guess they need acupuncture, or they have to be referred by a physician? What's the best way for them to address their health challenge?
I think both are okay. If they can be referred by doctor, by other doctors, it's okay. But if because here or even in China, not every doctors know acupuncture.
All
Not
right.
because they don't know what can acupuncture help them. So they if they meet patient, but the doctor can help the patient, but they they, they don't know whether acupuncture can help them.
All right. All right.
So if a doctor referred, it's okay. If no doctor
If they
referred,
just come
then
direct, they can
you
also
the
come
patient
directly.
can come to me and ask whether acupuncture can help them.
All right. All right. So with the acupuncture training in Zimbabwe, I don't know, do we have any sort of continuous practice or institution where they can learn? If somebody like now wanted to learn acupuncture, what do they do? Do they then just where do they apply?
In fact, they can come to the clinic.
Right.
I have my phone number there. They can contact me to learn at the clinic. They also can apply to study traditional Chinese medicine and acupuncture in China through applying to the Chinese embassy in Zimbabwe.
Right,
We
right.
also have
Right.
the funds to provide them to study in China, but maybe it's limited.
Of course,
So, but they can
I know funding
apply
is
for
always
that.
limited, but it's definitely worth a try for those that so all young people and those that are needing to explore something in the medical division. Maybe this is something to consider. How have you seen it helping maybe in China and so far in Zimbabwe? What sort of numbers of people would you say you have helped? I know you mentioned that you see maybe about 30 people a day. So over time.
So in fact, at my clinic now, more than 30 people a day come to have acupuncture. In fact, in China, for me, when I'm at the clinic, I have more than 30 people every day.
Okay. So if somebody came, what would you advise in terms of maybe the waiting period? What can they expect if they come to the clinic? Is there long queues? Is there a huge crowd? It's always by appointment, or can someone just stroll in and wait for their turn?
Yes, this is a problem because at present only me do acupuncture.
Okay.
So, but many people are waiting.
All right.
So I have to let them to make an appointment.
Okay.
So in fact, many people are waiting.
All right.
So what I can do is I can do my best to serve more people.
Yes.
But at present, I think I only can serve about 30 people
a day.
Yeah, but I think after more and more local doctors come to learn acupuncture,
Yes.
I think they also can serve people.
That would really help.
So more and more people can benefit.
Absolutely.
And so maybe after a period of time, maybe 1 year or maybe 2 years, more and more people can receive acupuncture treatment conveniently. No need to wait so long.
All right, all right. So, what days of the week can people find you at the clinic?
Because I have other errands to do. And, in fact, I made them to have my phone number and WhatsApp me. Then I can give the booking for them. Yeah.
Okay.
Because sometimes if I let them come to the clinic by themselves, too many people.
Too many people. All right.
In fact, some days more than 60 people a day. So it's very crowded.
I hear you. I hear you.
In fact, there are more acupuncture practitioners will come here to work at the clinic. There will be 2 acupuncture practitioners working at the center. So we hope to serve people from Monday to Friday. But if people want to have acupuncture, I recommend them to book first, because if no booking, many people come to the center, then there will be too many people. Yeah, yes. But the good news is that there will be 2 acupuncture doctors working in the center. Also, there will be some students studying here. So we hope to serve more people from Monday to Friday. But booking is also needed.
That is great news. From when can this happen? The 2?
Maybe from April. We hope to open as early as possible. Maybe from March. But because we have some work to do,
yes.
So April it certainly can open from Monday to Friday.
Wow, this is very interesting, Doc. Now, apart from work, we also just want to know, who is Dr. Zhu Wei? Is he a family person? Do you have recreation? What do you do when you're not working so hard?
In fact, as a doctor, especially for us, it is a lot of work for me to do. But of course, I have to have some time to relax, like on the weekend. And I like play badminton. In fact, last year I attended the Zimbabwe Open.
Badminton.
Yeah, yes. So on Sunday or Saturday, I will play badminton with my friends. Yeah.
Wow. Well, perhaps we could just have, this information is just so interesting. I think we will just need to have your contacts. We will share them with the viewers, but also just any parting words, any advice that you might want to give to those that are receiving acupuncture, some of your patients, perhaps just if someone is going for sessions, what are some of the things they just need to do to make sure also that their treatment is effective? Perhaps if there's anything you might give as advice.
For the patients, in fact, many patients come to the clinic after acupuncture. They feel much relief. In fact, for health, the most important thing is to do preservation.
Yes.
Like for the low back pain, long time sitting or heavy lifting can cause low back pain. Okay. So they have to prevent the causes. Like don't sit for a long time. Don't lift heavy loads, etc. To protect the low back.
So true.
In fact, in TCM, traditional Chinese medicine, the most important thing is to prevent the onset of a disease. Treatment is just one part of health service. Yes.
But prevention is very important.
Yes.
Wow. I don't know. I would have wanted to go on, but Doc, we've taken so much of your time, and we are so grateful that you were able to just take time off your busy schedule to just come and talk to us about acupuncture. I'm sure we will be coming to you again for more as we get demand as well from the viewers. But thank you so much for affording us this time. And we thank you for the work that you're doing in Zimbabwe. We are so grateful for all that you and your team are doing, and the training that you're also offering to doctors here in Zimbabwe that are interested in acupuncture. Thank you so much, Doc.
Thank you.